start with it. I'm glad to be able to do this presentation, because it is all about my job and being a counselor. And talking about the benefits and maybe challenging some of the stigmas around counseling. It's a powerful tool that I don't think a lot of people take advantage of. And it's a tool for empowerment, which is really kind of where I want to start this kind of the presentation off at. The ACA, the American Counseling Association, talks about counseling as being, a professional relationship of empowerment with individuals or families or groups to promote wellness. In some cases do some education, or there's other arenas that people do stuff in, like career counseling, or there's specific mental health. But I think the one thing that a lot of people go to counseling for is to improve self-awareness, improve their mental well-being, and to work on some preventative strategies to kind of help getting out of the cycle of some unhealthy thinking. And so that's kind of where we want to talk about with counseling. Just kind of want to do some of the kind of the basic oversights of counseling, like what is it, who provides it, what's it look like, talk about like I said, some of the pros and cons. There are some limitations to counseling, and then talk about and start off in the next slide. I'll talk about the need for it in the physician world, which is really where it comes to. There's a lot of reluctancy with physicians to seek counseling. I've been doing this job working with physicians. I've been working with physicians one way or another in either treatment centers or this directly, this job at OPHB for the last 14 years. And it's amazing to me the amount of time that I will talk with a physician and they've never personally sought out counseling for themselves, but they come in and sharing just loads of stressors they're dealing with, being at work or family or finances, or just their own personal well-being and how they've lost balance. There's a reluctancy, and I think that's been trained early on. We've talked about that in some of the earlier seminars. That's just that you got to do it on my own. You got to take care of it. I'm the person that people come for help, and I don't go out and seek and ask for help. And so we have this group of people that are overwhelmed with a bunch of responsibilities that have a kind of been trained or have a reluctancy to kind of seek help. And so I think it's no wonder that the burnout rates are so high. I think you can kind of see that some of the statistics I had there, that especially with family physicians, that burnout rate, from, it says in 2013, it was about 43% reported burnout, moved up to 50%. And so there's an increase in burnout. So there's increased challenges going on, an increased need, and yet there's still that kind of reluctancy. And that reluctancy sometimes is the individual kind of resistance that we kind of talked about earlier. And I know that some of the reluctancy can be also around what happens if I seek out help. Do I put myself at risk with a regulatory board or employment, or other arenas? And so that's one of the things we want to talk about too, as we go and kind of go through this kind of counseling presentation, and hopefully have some questions that maybe you guys want to feel free to ask about what are the limitations to confidentiality as it relates to physicians. I'll talk about some of the stuff, and I know I talked with Kate earlier, and if I forget to address them, she's got some questions she's going to remind me if I don't address during the presentation about, what are some established things that are already in place to protect physicians so they can seek help. Why does counseling work? It's a place where you can talk about whatever you need to talk about, and the person that's there will be engaged. The job of a counselor is not be judgmental, is to be empathetic and understanding, get some empathy and acceptance, which is when we're talking about problems where sometimes we put these things like, nobody else understand, or I can't talk about this, too shameful or too secretive, or I'm embarrassed by this. It gives an arena to be able to talk about that safely and know that somebody there is just going to embrace and hear about it and be empathetic. This one line says, "Speak the unspeakable," and I think that's a good thing. There's a great Bob Dylan line that said, "If my thoughts could be seen, they'd probably put my head in a guillotine." And I think we all have thoughts that are sometimes unhealthy or challenging, and sometimes those unhealthy thoughts dictate our behaviors. And I think this is a place to talk about some of those thoughts that may be really kind of challenging to us, that we feel, not, maybe embarrassed or concerned to share out loud. It's a safe environment You know, and it's a place where you can kind of share. It's going to be different than if you're trying to share with a friend or a family member. And the idea is that, you know, this counselor has a professional relationship, and their baggage is going to be presented back to you. You know, a lot of times when we talk with people that are family members, we start sharing some stuff, and they may share this, or their emotional entanglement, you know, sometimes gets in the way of like being able to be objective to the situation. And you can kind of eliminate some of that when you're going to a counselor. And I don't know, I know one of the things I've worked with physicians long enough is that I often work with physicians that when they're dealing with somebody who's got a mental health issue, especially like, you know, a family practitioner, where it's like they can give them, say, maybe an antidepressant, and then say go seek some counseling, but they're not really sure what that means. Like even the physicians I work with, I have medical students that come here and we talk about counseling, and they know it's something that's there, but they're not exactly sure what that means and what it is. And so I wanted to kind of just share that there's several different counseling approaches that are available, and different ways that they're working on, and different objectives with these counseling approaches. You know, we have things from like the first one, person-centered, which is kind of this idea of being an empathetic, open environment for a person to share. It's not really directed counseling. It's just a counseling where the client directs. The client comes in, shares what they want to talk about. The counselor just hears, maybe reflects and less than feedbacks, but just reflects back what they're sharing and lets the client kind of guide themselves. And there's things like psychoanalytical, which is, I think a lot of people kind of know, the Freudian kind of approach, where we're going to dig back from childhood and find all the pieces and why I do the things I do, and why I'm in the spot I'm at, maybe in adulthood from experiences I had when I was adolescent, to behavioral approaches that are much more concrete. Especially the CBT is a real popular one. In fact, most treatment centers that do any kind of sustained counseling, and this is probably the one that insurance companies reimburse the most, is more about cognitive behavioral therapy, being I understand the problem, I learn about the problem, and then by learning about it and doing some homework, I then enact and engage in different behaviorally different to the problems I'm bringing in. But there's several different kind of behavioral ones, like REBT, which is rational emotive behavioral therapy, or reality therapy, which is called choice therapy, which is really just basically a pro and con approach to problem solving, or DBT, which is kind of more of a self-talking ability to get internal dialect to kind of help guide and change behaviors. They use the DBT a lot with personality disorders. Gestaltian therapy, which is more of your kind of empty chair or experiential counseling. And then there's others like EMDR, which is kind of eye movement desensitization reprocessing, which is about working with people with trauma issues. Which is very powerful. Motivational interviewing, which we actually teach our students here a little bit about those skills, about helping clients that are resistant to get to change, working with them where they're at to help them move forward on their own pace, but by having ways to use tools to kind of subtly push them the direction that we hope to see them go. And like solution focus, which is really just about what's your problem, how do we solve it, kind of thing. So there's a variety of different ways. So I think sometimes people think of it as I'm laying on a couch, I'm going to start with my, when I was born to now. And sometimes that is a style, but that isn't a style all the time that people use. A lot of times some of these things are about where I'm at now and what do I need to do about it now. And some of those components of the past are important, but they don't get to spend as much time as into like, okay, you have a history of this. How do we find ways to challenge this? Look at some of the irrational beliefs or dysfunctional thought processes and try to, change that or restructure your thinking. So they're just kind of just sharing this that just show that there's a variety of different approaches. So when you say counseling, it's not just as easy as like just go in there and they'll solve the problems. There's different ways that counselors approach problems, and some are more into, some have better effects with different issues or different clients. I think that's probably more important than the issue is how does a person respond to therapy. Different types of providers for counseling. Here in the state of Ohio, I just want to kind of share, just the group that are available to do counseling to whatever degree. They have psychiatry and psychiatrists, which I think most of you guys know, and they're empowered also to be able to prescribe medications. Psychiatrist, it's kind of hit or miss that some choose to do some talk therapy, while others, turn off the phone real quick. We have Some choose to do therapy, and then some choose to just do kind of medication management and refer the therapeutic component to another resource. There's psychologists, which is a PhD level therapist. Then there's clinical counselors. That's what I have a degree in that, is being a clinical counselor. Social workers essentially have the same kind of degree as my license. Then there's drug and alcohol counselors, pastoral counselors, art and music therapists. All of them have a different degree. Basic counseling styles or basics or foundations of how they approach counseling. But I would say most counselors say they're eclectic. They take from pieces of each type of those counseling styles I shared in the previous screen and try to find their own mold to how they want to approach people. But of course, depending on the client, we try to work in and out of styles. Moving on to the next thing, the question is, how do these things get delivered? There's individualized, one-on-one, there's group counseling, and, in this day and age with, technology, we do telecommunications counseling. That's actually, becoming more and more prevalent because, and especially with people like physicians, yourselves, where you don't have a lot of time, people sometimes have more time to be able to sit and connect where they don't have to actually kind of go to a location, and it cuts down on some of that travel time or maybe even convenience of the time. We're actually working on setting up a EAP kind of service for physicians only here at OPHB, working with some kind of networking hospitals that are maybe in more rural areas that don't have direct EAP services near them. And so we find these, they can be approached in different ways. Most people know about the individual counseling, but I would tell you the most effective counseling typically is group counseling. The challenge why people don't like to go to group counseling usually is around the fact that, I feel like I'm the only person that has this problem. I don't want to talk about it in front of other people. But as we've learned as being human beings, we actually connect more when we have other shared experiences and people sharing the problem. And we learn from each other what's working, what's not working. And we also learn how to deal with certain dynamics, which is counseling is about, learning on dynamics. A lot of times people are coming in there because I'm struggling with my boss, I'm struggling with significant other, I'm struggling with the kids or whatever it is, and how do I communicate better? What have I been doing? Or when something frustrates me, I act out in this way. How are ways to challenge it? And group gives you that opportunity to kind of do some of those dynamic or behavioral changes with people and kind of in a live setting. What can you expect when you go to counseling? To be listened to, taken seriously, help remove barriers to achieve goals that you want to set. I would tell you, even on the approaches that are a little bit more concrete, the goal is really what is the client coming in there for, and how can we help them achieve a way to find a remedy for that? We have high ethical standards. Confidentiality is huge. I think we'll talk a little bit more at the end about confidentiality. But, as a licensed therapist, my obligations to report anything are child abuse and elderly abuse. Outside of that, it's a confidential environment to share things. Now, if there's potential self-harm or harm to others, we might have to break that confidentiality too. That would be an assessed situation towards what's going on with the meeting with the individual. Most counselors are to be direct and be honest. I know that's something I really try to pride myself when I'm counseling people, is to be direct with people, not beat around the bush, tell perspective of what I'm seeing, not telling answers, just hearing back and reflecting back, what's being shared. And the goal of this is that you come to counseling to kind of get some tools and think and get some restructuring, but it's something to take out on the day-to-day basis. Like, that's really the biggest benefit of counseling is that you spend some time here to refocus and look at your thinking to be able to help the rest of the time engage in better productive relationships or interactions with other people, or even have self-interactions that you feel more comfortable, confident in self, or more self-aware of why things are going on, why I may be acting or responding this way, and giving yourself the tools to maybe not follow through on like unhealthy thought patterns to, destructive directions. How can people maximize counseling? Is that you attend the sessions, be active, be honest, be open, be willing to try different approaches. I think most of you guys probably know that working with your own clients, that sometimes you give good direction, and if they follow the direction, they'll get the results they want, but they may struggle with that. And so it's the same with counseling. give good direction, good guidance, give some homework, give readings, whatever that might be. But if the participant doesn't do that, there is some limitation how far it goes. So being active and actively participate in it, it goes a long way. Apply it to your daily life, and talk with the counselor. I think this is one of the things I've learned with people that go to counseling is they go there and they're not feeling like I'm getting anything out of it. But then they don't say anything to the counselor and they just stop showing up instead of saying, I feel like this isn't working, or I don't understand why it's happening here. What's the goal with this? And being able to talk openly with that person about, what can I do to maximize this experience and to make it so that I feel like I'm getting the benefit and achieving or reaching the goal that I want to achieve. Because it shouldn't be the goal of the counselor. It should be the goal of the client to achieve, that we're trying to achieve. Again, lots of benefits: self-awareness, balance, new behavioral approaches, cognitive restructuring, non-judgmental listening, empathy, reflective feedback. I would tell you, I think that's sometimes one of the most important tools is that mirroring or reflective feedback that comes with counseling. Like you share a statement out loud, and then you let somebody say it back to you, and you hear it, and you're like, is that what I meant? Or I could see where somebody may have thought that differently than I intended that message to be sent. I think those are really powerful tools that sometimes happen in a counseling session that can help with something I might be carrying with me, this resentment or stress, and I don't understand why it's not being, and then share it and get that feedback in a safe environment may help me understand, which is really important, because I know a lot of times I work with physicians that are coming in here being referred this way is they're having communication problems with staff, communication problems with patients, they're getting overwhelmed in it, that just creating more stress, they're feeling underappreciated. And so it gives them going to counseling sometimes gives them opportunities to readdress or reprocess or rethink some of the ways that things are going on and look at what they can do to kind of empower themselves to approach a situation differently instead of just getting frustrated and feeling like they're out on an island. And the last thing there is confidentiality. I think that's an important piece that, that we want to address as it relates to physicians. So I think, and Kate asked me to just mention this. So there is an established laws right now in the state of Ohio for confidentiality as it relates to people that might be struggling with substance abuse. That rule is called a OneBite rule, and that gives a physician the opportunity, if they've never been to treatment before, to go seek drug and alcohol treatment. Now, there are regulatory statutes around what kind of treatment, duration of treatment, that kind of stuff that's available, but does give them an opportunity to seek that without a regulatory board getting involved, and that treatment stays confidential. That's typically the clients that we work with are people that are seeking that confidential treatment. And what we do is we kind of monitor and follow through afterwards, making sure that they're following all those rules, all those obligations, all those regulatory statutes that are there saying the board doesn't have to be involved as long as you do X, Y, and Z. There's actually active legislation right now, House Bill 145, that we wrote working with the medical board to try to improve that confidentiality rule and allow more people to get access and actually have more individualized treatment and get some of those statute rules out of the way where physicians can actually get more doctor-driven treatment as compared to regulatory board-driven treatment. That's one of the challenges of the current rule is that despite you can be confidential, there's still regulatory expectations you have to follow in order to stay confidential, or the facility is supposed to report you if you don't do what you're supposed to do. So we're working hard to change that. We're also working really hard to look at the mental health component and make that a much more safer and present some legislation that may help that. But just talking about confidentiality as it relates to a therapist, I talked about it earlier. If you go seek counseling as a physician, I'm not obligated to report anything to the medical board. Everybody on that list, except for psychiatrists, their confidentiality states that I shared with you child abuse, elderly abuse, or there was going to be harm to self or others. That we would have everything else would be able to be confidential. There is some challenges maybe as it comes to the applications and stuff like that, that there's some of the questions they may ask if there was a diagnosis. But again, if I'm going to counseling for preventative reasons and wellness and to deal with burnout is not a diagnostic disorder. So you can go seek help to kind of work on your mental well-being without having to have a diagnosis. So just to kind of put it out there, you know, sometimes I think people are fearful to try to do preventative work or wellness work, or just to deal with burnout and stress, and they're worried that it can cause them trouble. But none of those things are actually diagnosable disorders that would have any concern with being, you know, labeled or, you know, putting you know, a stamp on you that's saying you're mentally ill. So just want to kind of share some of that, because I know that's sometimes a concern for people why they don't reach out for help, and which is part of what the next things we're going to talk about is, you know, there's these stigmas and roadblocks to counseling. You know, people get this idea like if I go to counseling, people are going to think I'm crazy, or everybody's going to find out, or what, you know, I can handle things on my own. One of the things we have a great little video on our website, and it's talking about meditation and mindfulness, but I think it can be applied to counseling as well. Is this idea that we have we take the time out to work on ourselves. I think we presented this on the first video for our physical well-being. We'll exercise a half-hour a day, 45 minutes a day, something like that. We'll do. We'll take care of. You know, we'll comb our hair. We'll dress nice. We'll put all this effort into this external stuff. But when it comes to the internal thing, our brain, we don't spend a lot of time with it. I would think that was one of the encouragements of the mindfulness and the meditation presentations, was taking time. And counseling's in that same arena. Counseling is much more effective when it's used as a preventative or a wellness technique as it is as we're getting into a crises. And we better go to counseling, say marital counseling. Well, you know, a lot of times people go into marital counseling because one of the parties is like, I need to be out of this relationship, I want to get a divorce, and then we're going to go to counseling to save it. Where one of the parties already decided they're wanting to leave that scenario, and a lot of times the counseling isn't effective because the problem has already escalated beyond beyond the counseling. And much like any disease, it would have been nice if we caught this earlier, but this is where we're at now, so we have to do this more aggressive approach. The same with counseling. It's better if we can catch things earlier, so when they're starting to feel like a problem or starting to feel concerned, it's always better to kind of go in early, or just be preventative, or just talking to somebody on a you know, fairly regular basis, that you can talk about these things and process your thoughts and ideas. You know, counseling doesn't have to be, I have to go every week or something like that, but sometimes people just touch in monthly, bi-monthly with somebody, just for support, just to kind of make sure everything is going all right. It's that wellness checkup. And we have this brain that controls all the things we do, and we sometimes don't take the time to look at that. And I think one of the benefits of counseling is to look at that, and, you know, to look at our thoughts and our belief systems and our stuff. And some of those things are really powerful because they've gotten us in successful places, and some of those places things are not so powerful because they've caused some of their dysfunction, either in relationships or with coworkers or just with self, you know, and confidence, or, you know, self-awareness, and it gives us an opportunity to look and reflect on those things. The idea that we handle all our problems on our own is silly. None of us get anywhere without using the resources and help and tools with other people. We've all had mentors and teachers that have helped guide us, and I think that's, again, it's good to get outside perspective. You know, when we look at everything with just a sole perspective of ourselves, we're limiting the multitude of eyeballs that can be on a scenario. Yeah, problem's not as bad as anybody else's. If a problem's causing you a problem, it's bad enough for you. You know, I always think people compare out so much about when I need to seek help. If you feel that there's something that needs to be addressed, it's your issue, it's your life. Take the time to address it. You know, don't compare out to other people's problems. You know, it's a waste of time. Yeah, I would say that maybe there are counselors out there that aren't great. By my experience, and I've been to counseling, I've been on both sides of the fence. That most counselors are very good and helpful in dealing with an issue that gets brought to them. You know, sometimes I might not think it's great because I might be getting directed or getting challenged to do something I don't want to do about it. But that doesn't mean the counseling is not effective. It just means I have some resistance, which is another thing that counseling helps work on, my resistance to change, which is, I think, we've all been there, or we've struggled with wanting to make something. Or probably currently some of you guys might be struggling. It's like, I'm not sure what the next step with this. I have some resistance about doing it, even though I may have evidence that it's the best thing to do, because we get stuck. You know, we get stuck. You know, change is hard, and we get stuck. And the last thing is what the medical board found out, and I think I addressed that a little bit in some ways about, you know, you going to talk to somebody to deal with some kind of personal issues aren't things that the medical board needs to be involved in. They are more involved in things that are more significant as far as like having a more concrete diagnosis that might be interfering with your ability to practice medicine. And we already talked about if you're having substance abuse problems, that there is a path to deal with that. That is confidential. And so, you know, why the medical board has gotten involved with mental health issues or chemical dependency issues doesn't mean that going to see counseling is going to be something that would bring that into the forefront to them. There's a difference between having a disorder or diagnosis that's interfering with work or seeking help because I'm struggling with burnout. You know, I talked about this. I just really kind of want to reiterate again, like I want to look at counseling as more of a mental health preventative, you know, medicine, you know, the way to treat things. And I feel like it's a lot less invasive than having taken, like I'm going to take, you know, Lexapro and just, you know, calm myself down. It's a much less invasive to be able to learn behavioral changes that will actually create, you know, the ability to deal with like anxiety than it is to take a medication. You know, and you can still have some of that neurological restructuring that's happening there even without taking medication by doing it, you know, learning new behavioral structures and helping to change that, make that change in your brain just by being weller by your actions in life or your thinking or how you respond to your thinking. You don't have to have a problem to utilize counseling. Counseling is available for, you know, anybody. And it's supposed to be, like, again, it's supposed to be preventative. It's supposed to be helpful. It's supposed to be there to help restructure and guide and to be empathetic and to get listened to and have a safe place to dump the stuff that we carry. And we all have stuff that we carry. We all bring stuff, you know, like, I don't know anybody goes through life unscathed. And so, you know, the challenge is hopefully we can change the stigma sometimes that people have with counseling is that it's for people that are really got problems. Counseling is available for everybody. And human beings tend to use counseling one form or another, not professionals sometimes, but we do talk with our other peers or support to try to process it. So it's not this foreign concept. We do it. One of the challenges is sometimes we bring problems to people that don't have the expertise to deal with them. Where in counseling, you might be able to do it and get resolution or get awareness that you wouldn't be able to get without maybe professional assistance. I put some resources on here. This is, you know, a little bit just kind of talks about the benefits of therapy and how the benefits of support group. And then the first one is a video that kind of shows different approaches to counseling. It's like a video they showed any counseling school that's about like the founders of person-centered and Gestalt and how the approach is supposed to work. If you're interested in that, it's a pretty fun little video. It's older, but it's fun. All right. I will turn it back to Kate and Caitlin.
Awesome. Thanks, Nelson. That was awesome. Caitlin's actually unmuting everybody, so hopefully you've got some great questions to pose to Nelson. While she's doing that, I do appreciate, Nelson, that you touching on the OneBite rule through the state medical board and how counseling intersects with that. Any other comments about OneBite before we move off that topic?
Yeah, just so again, just to reiterate, it is a rule that is there to give, it's specific. I mean, it's talking about chemical dependency, but it's there to allow people to get help without having that be reported as an impaired physician to the medical board. We all know that addiction is an illness, and so an illness that could impact people's practice. So this is there to be able to give people that opportunity to get well. It's not a perfect law, in my opinion, but it's there right now. And like I said, I think we're making some drastic improvements to it with this new legislation that we're hopefully going to see enacted early next year. It passed the House by an 84-1 vote. So we don't believe there's any going to be hiccups going to the Senate or being signed by the governor. So, and I think that will open a lot of avenues. But it's specific to, again, chemical dependency. You know, mental health it's a different arena, and mental health. And when I talk about that, in the kind of sense of diagnostic, if you have a disorder and the severity of that disorder, you know, it has some different parameters.
Super. Thank you for that update.
Mm-hmm.
Everyone is been unmuted, so if you have a question, please post it to Nelson now.
Can you hear me now?
Yeah.
Oh, yeah. The question I have is regarding to finding the right counselor.
Mm-hmm.
So whenever you talk to somebody or you have a certain problem, let's say, you know, lawsuit or communication problem, marital problems, alcohol, whatever, you don't really want to spill your guts to 2 or 3 or 4
Mm-hmm.
therapists to find the right one. So do you suggest she's doing like a phone interview or like a summary to say, you know, can you deal with this, and that, and see that's the right person to talk to you for long, for a, you know, for a for a therapeutic relationship?
Yeah, I know.
You
That's
just
a great question. That's a
don't
great
wanna,
question.
you know, do the whole thing scenario again and again to 1, 2, or, you know, 3 people, I guess.
Yeah. No, I think that's a big challenge. I think you're bringing up a great question, because one of the things I think is really important about counseling, and I will, you know, I reiterate this when we have our staff and that's my case managers here. I think the most important thing about counseling is rapport building and feeling going to a place. Not only do they have the expertise that you need, but you also feel comfortable in sharing private, you know, stuff that it may be feel vulnerable to talk about. And that's hard. I mean, that's like, it's a really, because it's not like going to see a doctor, and I hope they don't minimize, but sometimes you go in there and it's a shorter experience, and you're kind of directing like an illness that you need a remedy for, and you guys have the expertise to kind of get the right medication or the right, here I'm going to spill like personal stuff. I'm going to say things I have not said to other people, or very few people. And so I think that is a lot more difficult. And it's like medication management with the psychiatry. Like, it's a frustrating thing to go, and 3 months I tried this, and you switch me again on this, and I'm trying to get that thing, and to be in that place where so it's hard. I do think that you can find the resources that people talk about, that they're specialties. And I think that's a good place to start. Like, I have a specialty in marital counseling, or a specialty in career counseling, or a specialty in addictions. And some of the licenses that we have indicate that. You know, it's an alphabet soup sometimes behind people's names. Like, what does this mean? What does this mean? But some people do have that. And so having a license to do a certain kind of therapeutic approach or a certain thing is helpful. But I don't know that there's a way to, I think people sometimes know what gender they maybe speak to better, and that may be helpful into the initial thing to, like, you know, so if I limit it down to, I feel more comfortable with males, they have the right expertise in this. And then I think you're kind of looking at, you know, other people's opinion, but some people want to go to counseling and want to be directed and have somebody to tell them what to do. And then some people want to go and just be listened to. And so it's hard until you actually meet that person. You have to, I think I encourage people when they go see counseling, tell them what you're hoping. Say, can you do, this is how even on the phone interview, I'm looking for somebody to be more direct with me. When people aren't direct with me, I take advantage of that situation. So can you be direct? If that's not your style, can you refer me to somebody that is that way, and maybe kind of cut down. But I don't know if I can guarantee that would just be, you know, because some people may say yes or no, and they may not be. But I think a counselor, if they're any good, also knows how to adapt to a person. You know, that's part of our job, is to be able to sit here and say, you fit, like, somebody wants this kind of approach, but that's not the case with this other person, and be able to adapt to some degree while still keeping a level of the integrity of the kind of counselor that they are, you know, as far as communication styles. So I think you're allowed to ask whatever questions you want to ask initially, and there are some things you can say by their license and credentials you can find out, but I think rapport building is tough. And I would tell you,
Expectations.
Yeah. And I would, you know, it's hard because a higher degree doesn't necessarily mean that they're more people connected. You know that it's. I think the best thing you get out of a counselor is somebody who's actually there with you and engaged and empathetic and does have that specialty. But I think it's more important sometimes just to feel comfortable by I'm sharing something private. You know.
Yeah. Thank you.
Mm-hmm.
Appreciate it.
Nelson, we have a question from one of our participants. Although we've discussed the realities of physician vulnerability and the challenges of being a community figure, do you have any suggestions as to how they find a therapist in the area in which they live in and not where they practice?
Okay. I feel if I'm getting that right, like they must practice somewhere separate where they're living. So they're looking for a person there. Yeah. You know, obviously anybody can Google search and look for a therapist, but that isn't necessarily what I think people want to do. I think they want to get some feedback. I think that's one of the things I think the previous question was asked. Can I get some feedback from people that have had previous experience with that. So one of the reasons why we're here is to do that. Although sometimes, again, we may miss on the connect that this person is in this area. We've had some experience and good feedback, but then somebody visits them and it didn't have the thing. Or sometimes the problem with it is we got good therapists, but their price range is out of, like, some take insurance, some don't. And especially when you're doing like a physician, when you want to like keep yourself confidential, sometimes you don't want to send things to an insurance company, so that does sometimes limit, some of the resources. But as far as finding a counselor, I would encourage somebody to, call us or tell us where the area is, see if we can help them. One of the things we're hoping to do too as our facility, and I think it's becoming more popular, is doing telecommunications therapy. Like the state does, the counseling board is implementing rules or has rules in place of how to do online counseling. Now it has to be video, like Skype kind of based things where we're seeing the face and interacting. And that way it actually opens up your avenue of who your therapist could be. You may not be limited to that area and be able to have more resources, to maybe a specialty that you couldn't get in your home area. But for me, I think one of the hard parts is, and you want to find a place is, you can look up whoever it is, but I would probably try to see if you can call us or connect with other people that use counseling services, and who do they refer to, would be the way I would start that process. Again, the confidentiality part is the counselor is you're supposed to remain confidential when you enter that thing, just like any medical experience. It's supposed to stay there, but if you're in a small community, obviously that's a barrier, because if you got one street, like the town I grew up in, New Concord, Ohio, and all the shops are out there, people can see you walking in, and they know what's going on there because everybody knows what every storefront is.
Right.
So,
yep.
That's why telecommunications is getting more popular, especially with physicians.
Well, actually, that's a perfect lead-in for our next question that was sent to us. You mentioned telecounseling options. Mm-hmm. Do you know if there's any online or phone apps now which offer access to national-based counselors for this?
As far as like a resource of a list of names?
Yeah, I think they're asking questions about if you've had any experience with these. So picking and recommending them for a patient if they want the ease of scheduling or some added privacy.
Yeah. Actually, I have. I may not be able to have we've been doing research a lot on this lately. One of my other case managers, he's had some experience in this previously, that I could probably come up with, maybe get some more information of some people that are actually currently doing telecommunications therapy. That maybe is something I can provide for you if somebody would want to kind of look at that as an opportunity. We've been looking at too, as far as just to kind of reassure on the confidentiality part, that the programs that you use that are HIPAA compliant, that protect that confidentiality, there's a few of them out there. And so these providers that we've been working with use those programs, and everything is like, starts online. You schedule your appointment, all those things, the assessments, and everything kind of get started online, and then you just do the face-to-face interactions through that. Mm-hmm. So I'll try to get a database of some people that have used that and provide that for you. And like I said, we're trying to build that up here too, but that's something we're not looking at probably until next year, because physicians have busy schedules, as every one of you guys know, high demands, and you need an opportunity to be able to get this help without having to rearrange your life, which is already challenging enough, because you want to be able to have time for the things that are important for your wellness, like family and friends and, personal relaxation stuff. So.
Super. Thank you. Were there other questions from the participants? So I have one more to pose to you, Nelson. Do you know of any resource where physicians can go in group counseling with other physicians?
Yeah, that's an interesting good question. Yeah, I do, but they're all related because people got into treatment centers.
Okay.
And so there are, I don't know of any of the support. So there's for the addiction world, I'm just going to share this. There's a self-help group called, they're caduceus meetings. And then they're basically recovery support groups for physicians, and they meet in places and they get together and they help each other with recovery. I have a few physicians that do groups with here and that are part of my participants, but they're groups that are directed by the counselor they work with, and they're actually like the guy I can think of right offhand does it because it's a men's group, and they're working on went through a divorce, and so he's with other professionals, but they're not all healthcare professionals, but they're going through a similar thing, and they do like a men's support group on that, and they meet once a week. And I have a couple other people that do similar kind of groups, that kind of stuff. But I don't have like that kind of like self-run like the Caduceus is for addiction. I don't know anything like that for like a mental health or support or burnout thing, unless, there are some like hospitals I know that people have initiated some support stuff with each other, and some of the physicians get together, or they have like a physician where they can come talk to, but not offhand like a specific group.
Super. Okay, well, great. Maybe that is a role that our Facebook group could play a role in.
Yeah, I mean, I think people can. I would encourage that, but it's hard, and it's hard because you get physicians don't like to be vulnerable sometimes. So to say I need help and get other physicians to join in, that takes risk.
Right.